Hello, and welcome to another edition of Good Deeds. It's brought to you by justserve.org. If you are looking for ways to make an impact, to make a difference in the lives of people right here in the Sacramento community, there are a number of organizations that are doing it every day, and justserve.org is a great place to start. Today, we're talking with the American Heart Association and Genevieve Lynch about a new campaign they've launched for the health of your friends, your neighbors, your coworkers, you here in the Sacramento area. Doctor, it's been too long. Tell us what is this campaign about?
So, Doctor, It's Been Too Long is a campaign sponsored by the American Heart Association, sponsored by a lot of medical facilities in Sacramento, like UC Davis Health. And it's encouraging people to come back to getting routine care from their doctors. In light of the COVID-19 pandemic, a lot of people stopped going to the doctor. They were, they were homeschooling their children, they were taking care of loved ones, they were working from home, they were told to quarantine, so they stayed in their houses and didn't come to their doctor's appointments anymore. So Doctor, It's Been Too Long is a campaign we're hoping will encourage people to touch base with their providers and help them get back into their care.
Yeah. I mean, some of these seemingly routine health checks can catch a lot of more serious health problems, and it can be a matter of life or death. What are some of the screenings that you recommend people start with, getting back to their doctor and starting with the basics? What should they be thinking about scheduling right now?
So preventative screenings are so important. So annual physical with their doctor is really important. What the doctor is usually looking for at these visits is screening for things like cancer, heart disease, diabetes, and these are all diseases that, if caught early and treated, can be well controlled and the patient can go on to live a very full and happy life.
Yeah, absolutely. And I might add too, your dentist, if it's been a while since you've
Yes.
seen your dentist, because a lot of people don't even realize the connection between the health of your mouth and your gums and your teeth and the rest of your body. It's all connected.
It's very true. A lot of people with diabetes have a lot of dental issues. They have gingivitis and cavities, and it's so important for them to have their see their dentist regularly, have their cleanings, resolve any cavities or gum disease that may be going on. Because if this is not caught early, it could cause severe damage of the mouth.
A lot of doctors over the last couple of years have understandably been overwhelmed with the number of patients, trying to treat people with COVID and other emergencies. And in many cases, we're having to exercise some patience trying to get back into the doctor for those screenings. In the meantime, what are some healthy habits that people can do to absolutely make sure that they are at their healthiest when they're going in for these screenings?
Well, first of all, of course, I encourage them to try and contact their primary provider. Even if they're not to be able to see the provider in person, there's things like video visits and telephone calls where they connect with their primary care to help, screen for those diseases and make sure that the patient is doing okay. There's some lifestyle modifications you could be doing at home. Um, Watching your diet, replacing one meal with a lean protein and a vegetable, some light exercise, maybe a 15-minute walk on your lunch hour. Things like that are small changes that can have a really big impact on your health.
Yeah. And I would say that's one of the benefits of the pandemic, if you will, is that a lot of doctors are, as you mentioned, meeting with patients via Zoom, online, telehealth. I mean, um, that's often a great place to get started if you've got something nagging, something that's been going on. You mentioned it to your doctor, and they can recommend different courses of action.
Exactly. I agree. It's really important. If you still feel like you don't feel safe coming out, because, COVID is still out there, we're still taking precautions. But I do want to let people know that most doctors' offices are taking precautions to keep you safe. Our staff is vaccinated. We clean the rooms in between patients. We're masked. So we're taking the precautions necessary. But if you still feel uncomfortable coming in, that's okay. Give your doctor's office a call and see if there's other alternatives to where you can meet up with your provider and come up with a plan.
So when someone does get either that telehealth appointment or that appointment with their doctor, what are some of the things that maybe they've overlooked for the last couple of years, little symptoms that maybe they've brushed off as no big deal that they should be mentioning to their doctor when they do have some FaceTime with them?
Well, I think it's important to realize that a lot of the conditions we screen for at annual appointments with your provider, you don't have any symptoms for. When you have high blood pressure, you may encounter a headache or some dizziness, but most people don't know at all that they have high blood pressure. When you have diabetes, sometimes you'll have some dizziness or increased urination, really fast weight loss. But again, there are people out there who are diabetic who had no idea they were diabetic. They thought they were just losing weight and they were happy about it. High cholesterol, same thing. You can have high cholesterol and not have any symptoms. And that's why these annual visits with your doctor are so important, so you can be screened and treated. Because the important thing to remember is with these conditions, with high cholesterol, high blood sugar, high blood pressure, it could cause long-term damage to your brain, to your heart, to your kidneys. So it's important to get in there and get it treated as soon as possible to prevent any further damage to your body.
Absolutely. Now, for more information, folks can go to www.heart.org/Sacramento. How can we as a community best support the work that you're doing to help keep all of us healthy? I know that the American Heart Association depends on medical professionals to volunteer, and maybe tell us a little bit more about that, and then other ways that we can support you and volunteer and help out.
Obviously, the first way to support is to take care of yourself, right? Go see your provider. If you are a medical professional with some kind of specialty training or instructions, reach out to your local medical center or to the American Heart Association. As you posted, www.heart.org/Sacramento. That's a great place for information and ways that you can help out in your community. There's lots of support groups that can use leaders. There's lots of instruction that can be given out to patients. Knowledge is power, right? And in helping with chronic conditions like diabetes and heart disease, teaching people how to change their lives and take their medications can make a difference and help them on their journey to a healthy and happy life.
Well, thank you for your time, and thank you for the work that you're doing to keep all of us here in Sacramento healthy.
Oh, thank you, Sheryl. I appreciate it.